My name is Cassandra Lee, and I'm the Chief of Orthopedic Sports Medicine at UC Davis Health in Sacramento, California. Today, we're going to be talking about the QuadTRAC Quadriceps Tendon Harvest Guide System for ACL Reconstruction. I have incorporated quad grafts into my practice because it is a robust, solid collagen graft of consistent, customizable diameter with options ranging from all soft tissue or the additional bone block if you need length. The QuadTRAC Harvesting Guide System allows me a hands-free visualization of the graft harvest site with guides that allow for a controlled cut in a consistent and reproducible manner because of a single-use blade. Here, the landmarks are drawn out, and we palpate the superior pole of the patella. A midline 3-centimeter incision is made, cheating that just distal to the proximal pole of the patella so that you have a mobile window for visualization. Using a pickup and Metz, you want to cut out the prepatellar bursa as well as this fat pad that sits in front of the quad tendon. This can be fairly vascular, so I typically use a needle tip bovie to get control of this area. You want to be fairly aggressive about removing this fat pad because this aids in visualization of your graft harvest. Use a guide track for blunt dissection so that you can free up all the tissue off the quad, eventually getting that zero align mark at the superior pole of the patella, which is important in the next steps. We will match the QView with the guide track, and you will hear and feel that feedback where you place the distal tip of the guide on the roof forward. You can see it click into place right there. We now insert the system where we're shifting it completely in, and there it is. That zero mark is right at your superior pole of your patella. The beauty of the system is that you can place the camera on the guide track with direct visualization of the quad tendon. As you can see here, we're a little bit into the muscle belly of the VMO to the left. So what we're going to do is then we're going to shift our whole system a little bit more lateral so that we can be more central on the quadriceps tendon. Now that we are more centered on the quadriceps tendon, we can go as proximally as far as 6, 7, 8, 9, or even 10 centimeters from the proximal pole of the patella. QView allows for an optional secondary portal if you want to try this in your first few cases. Here I'm placing the spinal needle to show you where this portal can be. I then make a stab incision to create this portal. I place the scope in the accessory portal so I can view as we cut the tendon. With the track cutter, you want to keep downward pressure on the guide track rail so that the belly of the blades stay within the tendon. Here we do about 30 degrees from the horizontal of the handle. You can see the length of the guide track from the accessory portal, but also on the estimator on the track cutter handle. So there's two areas for you to check to make sure that you have the right length of your graft. With the custom circular design of the blades, these will only cut 6 millimeters deep, and you can either push or pull maneuvers to create the medial and lateral borders of your graft. We confirm with direct visualization with the camera that our medial and lateral border cuts of our graft are around 7 to 7.5 centimeters. I remove the QView so that we can harvest the tendon off the patella. Because we're doing an all soft tissue graft, I extend the cuts distally and dissect the graft off the superior pole of the patella down to whatever desired thickness you'd like, partial or full thickness depending on surgeon preference. Once I free up about 2 to 3 centimeters of the graft, we add a looped mini tape traction stitch to minimize cheese wiring to the graft. Once we have full control of the distal segment, I use a long-handled curved Metz and Bomb scissors to free up the medial and lateral edges of the graft. The distal edge of the quad cutter device is sharp, so you can actually use the device to help free up the more proximal segment of your graft prior to cutting the length of the graft. I load the graft into the quad cutter and then spin the cutting device around the graft to make sure I free up the graft completely while holding tension on the graft. I then confirm the length and then use a trigger to sharply cut the graft. I put the QView back in to expose the graft harvest site and then close the defect with a first pass mini suture passer with 0 vicryl or whatever your preference with simple side-to-side sutures.